2 years ago, my wife had a motor vehicle accident, and through that process, I was handed discharge orders from the hospital, and I had many conversations with multiple providers before I could find her the follow-up care she needed coming out of the hospital. If the CEO of a large health system is having this much problem finding the follow-up care that is needed, how about the person that has no friends that are in healthcare, that doesn't know a doctor or a nurse, and is just subject to the discharge orders that we send them to find healthcare, follow-up care on their own? That's where we started the process of thinking about care navigation differently than we ever have.
Care navigation can be defined as connecting a series of activities in a way that create a seamless experience for our consumers as they work to get their healthcare needs met. We've all become very comfortable navigating with our phones or device you may have in your car. It's easy, it's simple, it gets you exactly where you want to go. That's the experience we need to create for our consumers as they go through the healthcare continuum.
We decided not to try to create one model that was going to fit everybody. Instead, we set a challenge out to every one of our hospitals, and we said, you go create what you believe will be the best process to achieve this outcome. We're at the point now where we have data from the field, we have observations as to whether processes are actually working the way we intended them to, and we have consumer research so we know whether the patients are experiencing what we intended, and now we're back together to share what we've learned.
Initially, when we began our navigation, a lot of our patients, they declined it. They didn't know what it was.
We don't even really fully define consistently what care navigation means. How can we expect our patients or consumers to understand it?
A single platform for communication, documentation, and for tracking.
Some patients can get up to 6 to 7 calls after discharge. So we really need to define also who is the quarterback of that. Is it the care navigator? Is it the post-discharge planner? Who is it?
We're recommending that it's a clinical person that would be the one to be our quarterback, but we will also have other team members that are maybe non-clinical that will maybe do the legwork for us. So they're the ones that are calling the physician's offices and making the appointments.
Enabling direct scheduling for our employee physicians, so kind of upping that opportunity.
But we need a way to be able to truly understand the needs and segment the patients and then match them to what the recommended interventions would be post-discharge.
We have seen our pilot programs in action, and we have seen the impact that it's making on patients' lives.
Coming out of the co-creation session, we have multiple recommendations. We know we need to focus on people and how to make this more consumer-friendly. We need to focus on the process and how we embed it into our existing interactions, and we need to leverage technology to better connect our system.
This will be the first of many iterative design cycles until we can realize our vision of becoming a viable, connected ecosystem.
Challenges like care navigation are the exact reason we have invested so heavily in our design center. What the design center does is provide a space, but it's really more than a space. It's a philosophy, it's a way of working that allows us to bring team members together, actually even customers, patients, community members together to understand how they engage with the work that we're doing.
The Design Center uses a unique skill set of design thinking that we've not had in the past. This allows us to use the tools of empathy research, co-creation, and iterative prototyping to bring the consumer voice into the center of our decision making.
Using design thinking, we can fail fast and cheap, so we can quickly get to prototypes so we can test them faster and make sure they're the best product for our consumers.
We need a mechanism like this, and I'm very optimistic that the space, the team, the commitment of the organization is what allows us to identify the solutions that will allow our vision to become a reality. We believe care navigation is the differentiator of our model going forward. All hospitals provide great care and have amazing technology. What really matters to the consumer is how do I access those services, and can you connect me seamlessly and effortlessly through that system of care? We believe that is the most important thing we can do for those we serve.